We will discuss the clinical features of infectious mononucleosis, mono, which is caused by Epstein-Barr virus, EBV.
Mono typically presents with a combination of fever, sore throat, swollen lymph nodes, and fatigue.
In the classic form of mono, nearly all patients experienced swollen lymph nodes, particularly in the neck, fever, sore throat.
Fever occurred in 98% and sore throat in 85%. Fatigue can be particularly troublesome and may persist long after the other symptoms resolve. For most people, the fever and sore throat improve within a month, but fatigue can last much longer. Fatigue seems to affect young female university students more significantly, impacting their studies and physical activity. Swollen lymph nodes in mono are usually symmetrical and most noticeable in the back of the neck, posterior cervical nodes, and behind the ears, posterior auricular nodes. The nodes can feel large, moderately tender, and firm. The swelling tends to peak during the first week and gradually improves over 2 to 3 weeks.
The sore throat in mono is often accompanied by visible inflammation of the throat and tonsils.
The tonsils may have thick white or gray-green patches. Some patients also develop small red spots on the roof of the mouth. Swelling of both eyelids, particularly with a distinctive S-shaped curve of the upper eyelid, can occasionally be seen. Age also influences how mono appears clinically. For example, in adults over 40, sore throat and muscle aches may be the most common complaints, while swollen lymph nodes are less noticeable. Fever is still common in older adults and can persist for weeks, often accompanied by elevated liver enzymes. In summary, mono most commonly causes fever, sore throat, swollen lymph nodes, and fatigue, but the presentation can vary. Some people have milder symptoms, while others experience significant fatigue lasting for months. The location and pattern of lymph node swelling and throat inflammation can help distinguish mono from other infections.
In atypical cases, further testing may be needed to rule out other conditions.